Hey everybody, Dr. Richmond, Dominion Chiropractic Clinic. What we're about to be going over are some simple exercises and stretches for upper cross syndrome. So what is upper cross syndrome? It's something we see in this office all the time. What it really is a bunch of tight muscles and a bunch of weak muscles. And it leads to anterior head carriage, where your head gets pushed out in front, and bilateral forward roll shoulders, and you end up looking like this. What it does to the spine is it twists it like so, which is very uncomfortable. What you end up finding with this is you have muscle pain, so neck pain, upper back pain, and what I'm specifically talking about is up in this region. You'll find that you can get shoulder pain, you get numbness and tingling in both hands, and also you'll get a lot of headaches with this. So it's definitely something you want to take seriously and address. Some of those muscles we're talking about are the pectoralis. This guy right here will get really tight. Upper trapezius right through here will also get really tight. There's another muscle right next to it called the levator scap right in here, which also gets extremely tight. The suboccipitals, which are a muscle group at the base of the skull, these guys are your headaches. Muscle group to get weak are the lower trapezius. And one last muscle group that gets really tight is the scalenes, which is right here in the front of the neck. So we're going to go over how to stretch and how to strengthen some of these muscles. Okay, so our first exercise is going to be the wall angels. And this is a really important one. And what wall angels does is going to stretch out some of the muscles in the front and do a little strengthening of the muscles in the back. How it's done is you start up against a wall, hence wall angels. Everything needs to be flush, so her back is going to be up against the wall and her head is also going to be touching the wall. Your starting position is hands up in the air, just like so. Then you're going to slowly bring them down, keeping your arms against the wall, which is harder than it looks. If you find that you can't keep your arms up against the wall, it just means your pecs are tight. So just keep practicing it, keep working it, and you'll find that you'll open up and you'll stretch these muscles out. So you keep going up and down just like this, keeping everything flush against the wall. You're going to be doing sets of 3, 15 to 20 reps. Really easy exercise. The next is going to be the scalene stretch. Scalene stretches are another tight muscle, and that's actually right here in the front of the neck. So if you would step on up, please. How you do this one? Super easy. You're going to take your right ear and you're going to pull it down to your right shoulder, and then you're going to look up in the opposite direction. And immediately, as soon as you do that, you're actually going to feel that stretch right in there on that left side. Believe it or not, it's the opposite side that you're stretching. So same thing, you're going to do the opposite side now, left ear, left shoulder, and then you're going to look up and away in the opposite direction. Again, stretching the opposite side, so you'll feel this on the right side. All you need to do is stretch this 30 seconds, and I would repeat it 3 times. For our final stretch, this is going to be the pec stretch or doorway stretch, and we're going to stretch out these pecs. The reason it is called the doorway stretch is actually you can do this in a doorway, so if you would imagine that this door was open and out of your way, you can brace against the doorway and lean in, but for our purposes, we're going to do it in the corner of the room. So Leela's going to demonstrate. You're going to start out with your arms at a 90, and then you want to make sure everything is good and flat. From here, you're going to slightly just step into the corner of the room and push yourself into the corner, and it's really going to stretch and open those pecs up. Just like the scalene stretch, you can hold for 30 seconds, repeating for 3 to 4 sets. That in a whole is upper cross syndrome, and your simple stretches, the wall angels, scalenes, and doorway stretches. If you have any questions, just give us a call.